Hello, Dr. Ucker. Are you ready for
Yes,
some questions? Hi.
Yes, absolutely, 100%.
Marvelous. So why train with live blood online, and how long have you been teaching live blood analysis?
All right. Well, I think, the main thing there is just that the course that we are offering is unique for a few very important reasons, and we'll go through them. So as the course tutor, I'm a registered homeopathic and naturopathic doctor, and I've been working with live blood analysis in my own practice for over 20 years. I've also been involved with live blood analysis training for almost 20 years as well, and have trained possibly around 500 practitioners, I would say, by now across the world. The course itself that we have is probably the most comprehensive that you'll find on the subject. And we've combined the perspectives of the leading pioneers in live blood analysis into one complete course. Now, most other courses out there will only offer one researcher's perspective. Now, in collating all the information, we included perspectives, treatment protocols, and other useful information from practice, and some anomalies also that were not clinically reliable were actually excluded as well. So I've included a number of useful practical points from my own experience with working with live blood analysis in practice, with clients, and from training other practitioners. And then we also included information on the actual physiological mechanisms behind many of the anomalies that help to bridge the gap, between conventional hematology and live blood analysis. And then finally, just the way that the course is actually delivered is also the main this complex subject. The online training is very convenient, and the lessons are sort of broken up into 12 separate modules, which allows the practitioner to actually assimilate the information much more gradually and much more easily, than having to attend a 3 or 4 day course where all this information is compacted into a short space of time, where people feel afterwards that they actually haven't really learned anything. So this type of format is that we found the best, and from our other practitioners that have also joined the training course, who had previously completed other live blood courses, they also said that this was the best way that they actually learned live blood analysis.
Okay, thank you for that. It's also the best way of learning, isn't it, over a long period of time, because there is an awful lot of information, isn't there?
Yes, absolutely. There's a lot of sort of information that needs to be assimilated and understood, but also a lot of technical. There's the large technical or practical sort of aspect to live blood analysis. So being able to take blood samples correctly, that is actually quite critical, really, really important in ensuring reliable results. So all those practical aspects are all really very important, and those take a bit of time as well. So certainly not something that you'll be able to learn over a 3 day sort of weekend course.
Okay, thank you. And the next question is, do I need a microscope to join this training course?
Well, it's not essential to have a microscope to join the course. We do allow attendees to enroll even if they don't have a microscope, but it is a requirement to complete the course that you would have a microscope. The final step for certification is to complete an assignment, which is a case study, and that, of course, you would need a microscope for.
Thank you. Now, how much time is needed for study between lessons, and are there any assignments?
All right, so we generally recommend that you set aside at least 2 hours a week to go through the corresponding module of the training course. So in each week's lesson, the contents from that specific module is discussed, but there is a lot of additional information in the module. So it is advisable that attendees read through that information during the week, and at least a 2-hour sort of time frame is what's required on a weekly basis for the theory. And it's also a good idea, as soon as you have a microscope, to also set aside at least an hour on a daily basis, at least, to work with the microscope. Of course, you could work, set more time aside for spending time behind the microscope, or less, depending on how busy you are. Obviously, the more time would allow you to get on top of the practical aspects a lot faster. And usually, when you start working with a microscope, it is so fascinating that it really doesn't feel like a lot of work. So people do tend to spend a lot of time, looking at what they can see under the microscope.
Okay, thank you. Just by the way, viewers, if you would like to post another question or any other questions, please put them in the questions box and we can answer them now. Zama is saying, I'm not getting in. Assist, thank you. Can't really do much about that at the moment. It's going to interrupt the flow. So I'll deal with that in a moment. Okay, so I'm in Australia, Australian time zone. How can I take the training course?
Right, yeah, we do have attendees from Australia. We've had quite a few over the years already, and they're able to get the full benefit from the training course. Due to the time difference, they're usually not able to attend the live lessons, but those lessons are recorded and they appear in the course materials on the training site, the following day. So attendees are able to then listen to the recordings and send through any questions they might have by email.
Thank you. And do you provide health solutions and protocols?
Yes, absolutely. That's actually really quite important. Being able to assess what's going on and to look at what's actually happening at the cellular level is what live blood analysis allows us to do, and it really is extremely fascinating. And being able to get that type of information in itself is quite amazing. But you obviously would need to know how to address it and how to correct those imbalances, and that's a very important part of the training course, and something that we have worked on over the years as well. With working with live blood analysis in my own practice, I've included protocols, from my own experience as well, and we've collated things from other training courses and other practitioners' research as well, into something that that would allow practitioners to understand what they're seeing in the first place, and then also to know what to actually do about correcting it.
Thank you. And Betsy has posed a question. I'm not currently a holistic practitioner. How would I perform live blood analysis without being a doctor or acupuncturist or massage therapist?
Right, so the requirements really depends on what the regulations are for you locally, where you are based. In a lot of countries, there are practitioners that are non-registered, non-medical practitioners who have done courses in nutrition and iridology, herbalism, and other forms of natural health, detoxification treatments, and so on, that are not registered medical practitioners, but there's usually an association that they belong to, and of course a structure for them to practice within. So we look at the scope of practice then based on the practitioner's qualification as well. So that depends on where you are based. But for the majority, this is not a medical test. We don't really analyze the blood, and we're not able to detect medical conditions from what we're seeing under the microscope. It really is a test used by complementary health practitioners, and the anomalies and imbalances that we can detect with the test fall all within the realm of natural health. So many practitioners use this as an additional tool. Practitioners that have experience and have been working in the field of natural health, from naturopathic practitioners, functional medicine practitioners as well, to practitioners that have done courses in nutrition and herbalism. And obviously they benefit from that in being able to see all this information that live blood analysis uncovers. But we also have some practitioners that join the training course and start, as a first step in a career in natural health, start with live blood analysis. Whether you would be able to do that really depends on the regulations around where you're based.
Thank you. And Marie is saying, will you be including blood samples of COVID vaccinated anomalies that seem to be cropping up now?
Well, this is very new territory, so we are actually still at this stage where we are collecting data and sort of collating data to look at what the common trends are. But we are definitely collecting all the observations from all the independent practitioners and putting together patterns that are reliable. So this is still a work in progress because it is still very, very new, but we are busy working on that, and we will most likely have a separate, small, shorter course that will just cover that individually.
That should be interesting.
Absolutely.
Yeah. So why does live blood analysis get such bad press in on the internet and Wikipedia?
Yeah, so it isn't sort of accepted by mainstream medicine, and there's quite a lot of scathing criticism actually on the internet about live blood analysis. We do have a separate webinar where we discuss this and the sort of underlying reasons for this in a lot more detail. But the main reason why live blood analysis isn't accepted in sort of mainstream medicine is because of the great divide that exists between conventional and complementary medicine. In complementary medicine, we work with imbalances and conditions that we diagnose our clients with, that are often the root cause of their symptoms and are actually foundational to their compromised state of health. But these conditions themselves are not recognized in conventional medicine. For example, your normal medical doctor won't recommend that the patient goes and does a detox, or won't diagnose them with latent tissue acidosis or candida. There are some conventionally trained doctors that, and even some specialists that use live blood analysis, but they're also not really running conventional medical practices and are working more in the field of functional and biological medicine. So in the view of conventional doctors, they're also not really real doctors, working with real medicine.
Okay, thank you for that. And what system or standard is used to measure live blood results? And is there a standard printout for results to the client?
That's a great question. It actually relates to something that it's quite exciting that we've been working on. So live blood analysis is a visual analysis. The analyst needs to be able to identify all the possible anomalies correctly, and they should also know what those anomalies relate to. And they should also, very importantly, be able to put all this information together at the end of the analysis, connecting the dots, as we say, to work out what actually needs to be done for the client. At the moment, the system is purely, the system that we're using is purely to allow the practitioner to view their client's sample on their computer and to save the images so they can compare when the client comes back. We supply the software to allow practitioners to do this with the microscope that we supply, and it is a very user-friendly system that's compatible across all operating systems. Now in the training course, Practitioners learn everything that they need to know to be able to assess blood samples correctly, so they're able to perform the analysis competently. And we supply a standard template then that they can use to produce a report for their clients. Now this works very well, and it's the way that practitioners have been using live blood analysis from the beginning, but we are working on a specific live blood analysis application that will combine the usual video features that we already have in the basic software with a patient management system and other useful features like producing reports automatically, a reference database that will allow practitioners to compare what they're seeing with a database of images of known anomalies, and then also a short list of focal points that will be produced based on the anomalies that the analyst detected. However, in terms of identifying the anomalies correctly, that's something that the analyst will still need to know, and they'll need to know what to look for, and that is of course why the training course is necessary.
Of course, okay. And is conventional blood analysis required together with live blood in order to follow client progress?
Well, it's necessary in some cases, but we actually don't refer a large percentage of clients, normally in a live blood analysis practice for conventional tests. There are some anomalies that may relate to an underlying medical condition. So in some cases it is necessary, if clients haven't had any other tests done, it may be necessary to rule out underlying pathology, so they might need to have conventional tests to do that. But the majority of clients in a live blood analysis practice don't really need conventional testing, as conventional testing is used more specifically for diagnosing disease, and they're actually quite crude and only detect problems when things have already progressed quite far. It's really only for the diagnosis of disease. It's more used in disease care as such, and it doesn't really have much value in preventative medicine. For example, a client that has a regular blood sugar test as part of a preventative protocol, it really isn't a preventative protocol because it will only detect a raised blood sugar level at an early level. So it's really an early detection approach, but we actually need to be able to identify the imbalances occurring in the background that take place for a long period of time before the blood sugar level actually starts becoming abnormal. So with live blood analysis, we are actually able to do that, and we're able to often see things and imbalances occurring in the system where conventional blood tests will not show any abnormality. We know that those interpretations are correct, because if we use the recommended protocols, the recommended interventions, we see those signs improving in the blood, and also the symptoms in the client improves. But yeah, unfortunately, that's also one of the reasons why live blood analysis isn't accepted by conventional medicine, because much of what we're actually able to see in live blood analysis, there really isn't another conventional sort of medically accepted test that is as sensitive, that would detect the anomalies that we're able to see with live blood analysis. The reverse is obviously true. If someone has, for example, a liver disease where the enzymes on conventional liver function tests are raised, we are going to see liver indicators in live blood samples, and there have been some small studies that have actually been conducted with that type of model, where they've shown a very strong correlation between findings in live blood samples and conventional tests.
Thank you. Going back to the software, Betsy's asking, so is the software something we as graduates of the program would be able to subscribe to or purchase?
Yeah, so there will be a license available, but it will be a preferential rate, obviously, for our practitioners that have gone through the training course. But that still will be determined. We're really still working on it. We are nearly there. We're looking at releasing the software in early 2022, so early next year.
Okay, thank you. And is there an exam, and will a microscope segment be included?
All right, so there are tests, as part of the training course, each attendee gets access to our e-learning platform. We have an online training platform where you'll be able to access the course materials. So after each module on the online training platform, there is a test element that needs to be completed and passed, and then there is an assignment in the form of a case study that must be completed for certification. And we do have detailed information in the course materials on microscopes regarding the microscope question there. Dark field specifications, we go through important specifications of microscopes and on what to look for, and also the specific settings that need to be used on a microscope to actually view the samples correctly. It's not just a case of putting the sample on the slide and looking at it. There are specific settings that are used at specific times, and also the way that the sample is actually firstly analyzed. We initially scan through the sample, very important and really quite key in determining or ensuring that you have reliable results. So that's also something that is covered in detail in the course.
Thank you. And Marie is asking, do you have a recommendation of a complementary course that could be taken in microscopic nutrition that would work well with this course?
Well, there are a few courses in, just in good holistic nutrition that we can recommend, and we have recommended a few. So there are a few available and a few online courses available that we can recommend.
Okay, thank you. And is live blood results accepted by mainstream conventional practitioners? You might have already covered this, but
I think we have covered that. So also, if I can just add to that, I think with regards to referring clients to conventional practitioners, that sometimes depending on your scope of practice, if you as a practitioner, if you're not able to refer directly to conventional laboratories for specific tests, you'd have to refer to a conventional practitioner who would then refer the client. So even in those cases, it is advisable to rather deal with a practitioner who is has more experience with working with natural medicine, or some sort of understanding of the basic principles of natural medicine, because it is really difficult to explain live blood analysis results to a conventionally trained sort of medical practitioner. We've had a few discussions with practitioners over the years, and it sometimes is quite challenging. We have anomalies, for example, in dry blood samples that indicate vitamin C deficiency. And in conventional medicine, it would not be considered vitamin C deficiency unless they have scurvy. So the issue, that conventional practitioners have is that if you then send for a conventional test, that's not going to show a major deficiency. So why would you be using, a vitamin C at this point? So it's the difference between preventing disease and ensuring and maintaining optimal health. Of course, you'd want to keep your levels at optimal levels and prevent them from going so low that you actually develop a deficiency disease. So it is a bit difficult to explain some of the results to conventional practitioners, but we usually, if you don't have access to a conventional practitioner, we do have in the training course, under each anomaly, actually, we have a list of recommended conventional tests, so that, if perhaps there are some worrying signs or symptoms in the case, or if you've been working with a specific anomaly and it hasn't really changed or improved, there may be some further tests necessary, and we have specific tests there that are recommended. So you can even just send a list without going into too much detail on your findings, just a list of recommended tests.
Thank you. And are there persons or conditions where live blood analysis is not recommended?
Not really, no. It's really valuable in every case, and practitioners who use it, tend to use it with every one of their clients, just because of all the valuable information that they get from it. And it becomes difficult working in a practice without that information. The test can be performed on people of all ages, including infants, even if necessary. There's no real interactions with medication or any other medical devices, and the test itself is minimally invasive. It's a finger prick, so there's no real risk involved with that. And we do cover the risks and proper blood sampling, safe blood sampling in the course as well. That's one of the first chapters in the course.
Thank you. I always liked your quote, working without live blood analysis is like a dentist working without an x-ray.
Yes, absolutely. And just also as a patient, you'd probably prefer to go to a dentist that has an X-ray. Although a dentist without an X-ray might be able to help, you'd probably be best served going to someone with all the equipment.
Yes, I think so. Last question: is live blood analysis legally covered as a part of medical care?
Well, no, unfortunately it really isn't, and that's again, we have this sort of great divide between conventional and natural or complementary medicine. So yeah, if you spend some time on the internet, you'll find scathing reviews about any natural and alternative type of treatment and device. So it's really not covered in conventional care by sort of conventional medical insurance companies, and even trained practitioners that use it, that have all the necessary practitioner codes. When they use it in their practices, they usually just bill it as a normal consultation under the normal consultation code. There's no specific code in for the procedure of live blood analysis.
Okay, and another question from Betsy: do you also train on treatments, tinctures, remedies, etc., for the conditions that we discover in the blood?
Well, we do have information in the training course on specific protocols. So under each anomaly, we actually cover recommended interventions that include it would include specific herbal formulations and other natural type of supplements, vitamins and herbal products, depending on what's actually found to be deficient. And we do go into detail on the specific forms and the dosages that would be required as well, because it is quite important to get that right as well. So that is all included, and there's also information on dietary changes that would be necessary. It's not just a case of someone just taking a supplement to address whatever has been discovered in the blood. It's also usually a change in lifestyle and diet that's required. So that's also included in under each anomaly. And with live blood analysis, because it has such a visual impact, it's one of the only tools that I've seen where we actually are able to get sort of enough motivation and commitment from people to be able to change diet and lifestyle, and they get quite encouraged to see the changes taking place in the blood as a result of those changes. So a lot of positive reinforcement there, and people usually stay on track as well, and they notice that how things start affecting them. So it really also helps to show people how, you know, what they're doing on a daily basis in terms of their diet and lifestyle, sort of daily choices, how it affects your health at a cellular level.
Yes, it is very encouraging for them to see the results, isn't it?
Yes, yes, absolutely. And it's always been quite difficult, you know, as a natural health practitioner, we're always advising people, you know, stop eating this, stop drinking that, and change that. And it really is quite difficult for people to change. And often people would, you know, get exasperated, and you know, they wouldn't know what they should be eating. So it's quite difficult, and to you know, to get compliance is quite difficult because people are used to their habits. So changing that is quite difficult. But live blood analysis is I think the visual impact is actually strong enough to motivate people to actually change. And what's great is, you know, being able to see those changes, so people really become a lot more responsible, you know, with their own health.
Okay, so thank you very much for that. Also, just to mention that we do have a training course beginning on Tuesday, September the 28th. If you'd like to find out more information about that, you will be able to find that on our website, which is www.livebloodonline.com. And also just to mention that with the training course, we do supply 2 wall charts with most of the common anomalies, which is they're laminated there for the wall and make life much easier. And there's also a training site included where you'll be able to find videos, pictures of anomalies, all sorts of information to get you started and help you in your practice. And if you need to get in touch with us at all, you can email us at info@livebloodonline.com. So if you have any further questions, please email us there. And otherwise, unless you have any other questions in the box, we will finish the webinar. So anything to add to that, Dr. Ocker?
I think we've covered everything there, Elizabeth. I think the only other thing is the Facebook page. I'm not sure if we mentioned that. It's quite a good platform for sort of ongoing, continuing education. So practitioners that have completed the course interact on there, post findings of their patients, and you know, we also go in there and discuss and look at the comments as well. So a great platform for practitioners to continue learning.
That's true, and also to pool resources and learn from each other.
Definitely.
Okay, so thank you very much for Dr. Ocker. I'm sure that was very useful for everybody, and we look forward to you joining us on one of our training courses. So thank you very much from me, and thank you, Dr. Ocker.
Yeah, thank you very much. You're welcome.
And thank you all, and stay safe. Bye-bye. Thank you. Bye-bye.
Thank you. Bye-bye.